The Chinese mainland has reported 44 new infections in the past 24 hours. 33 of them were locally transmitted and 11 were imported. Of the local cases, 31 were reported in Beijing. The city has raised its emergency response to level 2 as over 100 new infections have been reported in the past week. Besides Beijing, other capital megacities like Tokyo and Seoul are also facing infection clusters. While some worry over a second wave of outbreak, medical experts spell out what it takes to have a resurgence. Earlier, I talked to Professor Dean Jamison from the University of California. He's a member of the National Academy of Medicine of the U.S. National Academies of Science, Engineering, and Medicine. He believes, while the virus is still circulating, it is not surprising it will resurface from time to time anywhere in the world. Your response to the latest situation in Beijing. Apparently, over the past few days, we've noticed the clusters of outbreaks, and the confirmed cases reached much more than 100 after more than 50 days of no confirmed cases. Your response?
Well, frankly, I'm not surprised. The virus will keep coming back, and my guess is that it will get under control. Hopefully it will, but I think given that the virus is in the world, it will be coming back to China from time to time.
We've seen that, Professor, capital cities in China, in South Korea, and in Japan are all right now at the same time experiencing clusters of outbreak, and these are mega cities. What do these phenomena remind us of? After all, these three countries seem to have early success of handling with the first wave of COVID-19.
Big cities seem to be the breeding ground, at least the initial breeding ground. So I'm not surprised that it's three big cities that we're seeing these outbreaks. I wouldn't characterize these as a second wave yet. Maybe they'll get a lot worse, but until they get much worse than they are now, I think that they're outbreaks that can be put under control, not really a second wave.
What would count as a second wave? What would you count as a outbreak or clusters of outbreak, sir? How would you define the two very different phenomena?
Well, I've spent a little time thinking about that, actually, but if the number of new cases per day became something like 10% in my mind of what it was in Wuhan when it was bad in Wuhan, or similar numbers for the United States or Seoul. That would be a lot of cases, a lot of new cases. That would seem to me to be potentially getting out of control and something I'd call a second wave. 1 or 200. It's interesting. I had a long phone conversation today with quite a famous virologist in the United States, and his view was rather different. He thought the 100 cases in Beijing were more worrying than I do, and he's a virologist. My guess is they'll get under control.
Now in Beijing and Seoul, massive testing have been exercised. Now, just to give you a number, since the Xinfadi market was believed to be the core of the cluster of outbreaks, more than 90,000 people being tested over the past weekend. And that number is still growing as we speak. In this hot weather, people lined up out there, and also the doctors are trying their best. Will this be the only way out, sir?
Well, I think this is the way out, short of the lockdown. I think that it can be brought under control without a major lockdown.
That will be the new normal, some say, that we have to face right now. Do you agree?
Probably for the next few years. I'm not sure anybody knows too much about it. I certainly don't feel like I'm an expert at that. But I think we're going to see outbreaks, and I think in some countries we're going to see second waves.
what about in the United States where you are? We have seen the numbers coming up and likely to reach 200,000 in terms of deaths in quite a short period of time. And also massive demonstrations for BLM. And some say that could be a breeding ground for the spread of the virus because people are in close contact with one another without social distancing. Now, Professor, are you worried?
Yes, but we'll see in a few weeks, but my guess is that it will not look good.
So at this point, sir, as a scholar, what do you think is the best way to prevent and control?
It depends on the phase of the epidemic. If it's an outbreak like in Beijing today, testing, contact tracing, treatment, isolation, that will probably be enough in a lot of cases. And I think in some parts of the United States, that will probably be enough. But in other parts of the world where the virus has gotten more out of hand, I think there's a paper I've been working on recently suggests that voluntary social distancing when the epidemic becomes bad, and we were looking particularly at 13 European countries, that there was a lot of stopping of use of public transportation, staying home, not going to restaurants, that was completely voluntary, that happened before the government stopped down. And that seemed to have an important impact on the epidemic, and that's not a government policy, that's a population reaction. But on top of that, the government policies, very strong policies, like in Spain, for example, in Norway, that added, and those countries have been successful in the first wave.
Yes, indeed. Many countries in the world have been suffering from the COVID-19, but policies in disease prevention and control vary from nation to nation, and that leads to great differences in the containment of virus spreading. One of the most successful areas that have been over the past few months is Northeast Asia. Countries like China, Japan, and South Korea have been responding actively in the first phase of fighting COVID-19. So do countries such as New Zealand and some of the others in Europe. But for countries that are falling behind in easing of the curve to increase the cases, how do policies relate to results of the virus containment? Professor Jamison explained with the conclusion of his latest research. Professor, I know you and your team have been working on over the past weeks on something about comparing the performances of various countries and regions in terms of their first reaction to the impact of COVID-19 and the follow-up procedures until today. Tell me generally, what is the conclusion you have reached so far with your research?
Well, the main purpose of the research that we've been doing is that to try to just have a measure of how well countries do. We haven't spent so much time ourselves looking at what determines how well countries doing. Well, obviously, we're interested in thinking about it. And to me, striking thing, even though I should have known, but there's a huge variation across countries. We see patterns that are not surprising. United States, Sweden, United Kingdom are countries that have done, rich countries that have done fairly poorly. Some of the Asian countries that we all know have done well shows up in our numbers, including New Zealand and Australia. In Europe, Greece, surprisingly. So it tells us where to look, which countries did well, which countries did badly. Do we see patterns then in what they did that seem to correlate with success or lack of?
So what exactly are these patterns, Professor, you are talking about? What have you found so far based on statistics that certain measures would always be better, and under what time frame? and how is it being interacting with the public of that country or of that region?
One thing is that there are different ways to success. That the fairly strong lockdown measures and isolation measures in China clearly, in my view, clearly have led to success. Less strong measures have also led to success in Korea, New Zealand, Australia, but still strong measures, still quite strong measures. The early leadership of the country, the political leadership at the top, if they wait, if they don't take the numbers seriously, that makes a huge difference, because that gives the virus a chance to grow within the country. And certainly one of the great problems we had in the United States is the political leadership was in denial for 6 or 7 or 8 critical weeks. And things just got out of hand during that period.
How do you see, Professor Jamison, about the opening up of the economy while at the same time dealing with the evolving COVID-19 situation? Let's just use United States as an example, and also maybe use China as an example, because these two economies are dealing with it at different stages, certainly. So how should we see the US case right now? We saw some of the problems with early opening, which have led to certain states after a spike of cases once again to close down again. How should we understand the balance between opening up and also deal with COVID-19 prevention control?
Locking down has many dimensions to it. Most extreme dimensions, people have to stay at home. My wife's family, for example, lives in Heilongjiang, and for months they had to stay at home. That is one dimension, but short of that, there's school closing. There's a difference between elementary schools, secondary schools, and universities, making public places that are low risk available early. The other dimension, I think, gets back to what's constantly on my mind, actually, is how do you effectively isolate the people that are positive? How do you find them first, obviously, with testing and looking for symptoms? But once you've found them, how do you isolate the ones that are infectious for as long as they need to be isolated?
Yeah.
And create incentives for those people not to go to work, not to go to school, but to stay home. And those have to be important financial incentives, in part because so many people have to go to work. And unless their income is made up some other way, they will lose at risk. And it's a very hard choice for them.
Before we go, could you tell us about your understanding of what to come, for the next stage of prevention control when we still do not have a vaccine yet?
After a country has gotten through the first wave and closed the epidemic down, like China has, and now 10, 15 other countries have, I think the aggressive testing and isolation, selective social isolation, but making sure people continue to wear masks, that they're careful about distancing. They don't. It's also a problem in China because they don't necessarily shake hands, but changing in the United States to more Asian ways of greeting, all those things can be done without hurting the economy very much. So that's the hopeful sign before you have the vaccine, before you have the drugs that work. On the other hand, there are new approaches to vaccination that I've seen the scientists talk about. I worked with I mentioned before, Robert Gallo, the AIDS scientist, who's a virologist. He works closely with scientific colleagues in Beijing at the China CDC, and Beijing University, and he works closely with scientists elsewhere. These scientists talk to each other all the time, when they're together, they have dinner and they have a drink and they share information. And right now, there's a lot of discussion between Chinese scientists and Robert Gallo's group in the United States about use of existing vaccines, or polio vaccine in particular, which might have substantial short-term but important effects. So there are multiple directions that might be tried. We might see that tried in Beijing. Who knows?
Professor Dean Jamison, thank you so much for joining us. All the best.
My pleasure. Glad to join you.